When looking to the Syracuse VA Medical Center ICU for improvement ideas, the consistently elevated levels of hospital-acquired infections presented an opportunity for an improvement project. Recent attempts to reduce the rate of infections have promoted proper hand washing and the use of personal protective equipment such as gowns and gloves. While these methods are vital to limit the infection rate, they have not eliminated the problem. Some ongoing infections of concern are C. difficile, lower respiratory infection, catheter-associated urinary tract infection, and central line-associated bloodstream infections. Evidence from a literature review shows the positive impact of chlorhexidine gluconate, or CHG, bathing on infection rates among ICU patients. The wipes were being stocked in the ICU, but were not being used by nursing staff. Instead, nurses were using soap and water bucket baths and traditional bathing wipes. The evidence and improvement idea were discussed with the managers who approved of the project idea. The project team consists of unit managers, the clinical nurse leader, the infection control officer, and several staff nurses. The aim of the project is to reduce the rate of hospital-acquired infections in the Syracuse VA Medical Center ICU by 25%, from a starting rate of 24.6 hospital-acquired infections per 1,000 patient care days by December 2017, by implementing a daily CHG wipe bathing protocol among ICU and surgery patients. An education folder was provided to staff with information including the bathing protocol and technique, current infection statistics, and a cost savings analysis. By providing comprehensive information, the project team hopes to engage the staff and improve compliance. The protocol dictates that nurses will use 1 pack of CHG wipes daily, with emphasis on cleaning insertion sites and the 6 inches of tubing closest to the skin. Using the Plan, Do, Study, Act cycles proposed by the Institute for Healthcare Improvement, the project team has so far initiated the first test cycle. The team planned the intervention using evidence from current literature and established outcome measures. Outcome measures for this project include compliance rates and hospital-acquired infection rates. The Do phase of the cycle consisted of the first round of testing CHG wipe bathing on ICU patients. The team has entered the study phase, in which data and compliance information are observed to determine which changes must be made to the project to improve the compliance and infection rates. The Act phase involves improving the plan based on data and feedback and improving the project to roll out the next PDSA cycle of testing. Implementing the project was challenging. It is difficult to encourage staff to adopt a new practice change. In order to determine whether the CHG wipes are effective, compliance among staff must be consistent. Using staff and project team feedback, a wipe warmer was ordered and a compliance check sheet was added to the patient's chart. With these changes, the compliance rate did show improvement. The team is awaiting infection findings from the second and third quarters to determine effectiveness of the intervention. If proven successful, a formal CHG wipe policy will be added in the ICU and efforts will be made to spread the change hospital-wide. The outcome of the intervention has not been shown yet, as infection rates will take several months to show decline in parallel to improved staff compliance and technique. The project team expects to see a decline in hospital-acquired infection rates. In addition to the direct impact on practice, staff have shown positive changes in other ways. Staff are becoming more involved in the unit and expressing interest in carrying out other projects. Nurses have realized that projects on the unit are encouraged by managers and that they are not overwhelming when we work together. Nurses have been contributing more often to our huddle board, which is a means of presenting ideas for change to test on the unit. Regardless of whether CHG wipes reduce infection rates, I know that my project has had a positive impact because it has inspired others to take part in improvement initiatives on our unit.